There is no question that the United States needs to improve its practice in mental health treatment. Euthanasia is not a practice that is meant to be used as a cheaper alternative to mental health treatment. Since 2002, the Netherlands has been one of the few countries where euthanasia, under strict conditions, is regulated by law. Countries like the Netherlands act as a great example of how the United States should develop and implement euthanasia into strict, defined practice while simultaneously improving palliative care. From the 1990s to present, a Dutch study found that the practice of ending one's life without an explicit patient request has continued to decrease. This could be due in part to the regulation of euthanasia and enabling patients and physicians to openly discuss end-of-life preferences. Furthermore, an advocate for euthanasia in the Netherlands argued that having an institutional practice is preferable to individual decision-making, because it is better suited to preserving the autonomy of the parties involved, to treating like cases alike, to allocating resources in an efficient way, and to improving the result through advanced planning and coordination of care, thus enabling all parties involved to rely as fully as possible on the credibility of the process and of the outcome. Lastly, in a study that measured the occurrence of policy statements concerning euthanasia, 75% of all institutions measured had specific conditions. And 30% of those institutions that euthanasia was never allowed was due to the institution that treated incompetent or mentally disabled patients. Overall, a patient should have the right to euthanasia with palliative care as an alternative and also as a combination if needed.